Autoregulation refers to the intrinsic ability of an organ to maintain constant blood flow despite changes in blood pressure. Autoregulation ensures that critical organs, such as the brain and heart, are adequately perfused within a range of blood pressure values known as the autoregulatory limits. For example, when blood pressure decreases, baroreceptor reflex constricts much of the systemic vasculature, but blood flow to the brain remains largely unaffected. This is because the initial decrease in flow will cause small arteries and arterioles in the brain to dilate, returning the flow to normal or near normal levels, typically within seconds. Conversely, when acute increases in blood pressure produce an initial increase in flow, small vessels will constrict to reduce flow. Autoregulation only works within certain limits of pressures, the points at which blood vessels dilate or constrict to their maximum capacity. Different organs display different degrees of autoregulation. The most robust autoregulation is observed in the brain, spinal cord, heart and kidney, followed by skeletal muscle. Abdominal organs and skin show little or no autoregulation. Mechanisms underlying autoregulation may vary between organs. Several possible mechanisms have been described. Myogenic mechanism is based on the ability of the vascular smooth muscle, especially in small arteries and arterioles, to constrict or dilate in response to changes in blood pressure. When the pressure within a vessel is increased, the vessel responds by constricting. Vascular smooth muscle cells have been shown to depolarize when stretched, leading to contraction. Conversely, a reduced pressure results in smooth muscle relaxation and hence vasodilation. In the kidneys, myogenic response acts in concert with tubulo-glomerular feedback, which senses variations in flow and fluid composition at the distal tubule and adjusts the diameter of the afferent arteriole accordingly. Metabolic mechanisms match blood flow with the tissue's metabolic needs. Tissues with high metabolic rates release substances that cause vasodilation, increasing blood flow, while vasoconstriction results from washout of these metabolites. Carbon dioxide and hydrogen ions are examples of important vasodilators, especially in the brain. Potassium released during muscle contraction is associated with increased blood flow to skeletal muscles. Endothelial mechanism is based on the ability of endothelial cells to release various vasoactive factors in response to changes in flow velocity or shear stress. An example of such factor is nitric oxide, a vasodilator.